And then I put another differential here. This one is called lipodermatosclerosis. The reason why I put this one, this lesion actually fall into the appendiculitis chapter. The reason I put this because for this lesion we usually see stasis dermatitis changes in the superficial dermis, papillary dermis for this one. But when you see this big punch and then deep into the subcutes, usually you won't think about stasis dermatitis. You should think of why maybe the family dog, why the dermatology, they do this deep punch and then include the subcutaneous fat. But when you see the epidermis, if just show you this picture, kind of really similar to the stasis dermatitis. We have this small vessel proliferation here. Sometimes we may also see hemosiderin. So for this lipodermatosclerosis, if you want to make the diagnosis, first you need to see some stasis changes in the epidermis, and then in the subcutaneous fat, we want to see one pathognomonic changes. When you see this with the stasis changes, I think you can make diagnosis of lipodermatosclerosis. We call this lipomembrane changes. See this, it should be a adipocyte, but adipocyte, you can see this is necrosis of the fat. When the septate of the fat, I think the membrane, they just break apart, they will leave like this, like membranous changes. We call this membranous changes. So these changes with the stasis dermatitis changes is highly suspicious for this lipodermatosclerosis. But I think for the broad, I don't think they will give you this line kind of too much. And then another changes, you can see this dermis. Usually in the dermis, we should see some fibroblasts. That means this pink material, we need to have more this nucleus stay inside. But you can see some of these collagen, they just lose this nucleus. That is one of the changes we call the sclerotic changes. So this is not just fibroblast proliferation because they lose their nucleus, just this thickened collagen without nucleus.